Welcome to the show, Director of ASH, Ben Youdan. Ben, thanks for joining us today.
You're welcome.
I imagine you've been busy today talking about, what the incoming, I guess they are now, aren't they? They are the current government. Mr. Luxon was sworn in this morning, and what they're planning to do with Smokefree New Zealand.
Yeah, well, absolutely. I mean, probably a big, sort of legacy piece of legislation from the last government was this smoke-free bill. And essentially what that did was address this huge gap we have between cigarettes, something that kills 5,000 people every year, still being available absolutely everywhere for sale. And the fact that we now have much less harmful products, mostly in the form of vaping, which have seen masses of people quit smoking as a result of move to these safer products. But they were much harder to access. And so the bill essentially went, we're going to put an end game in for the smoke stuff because that's the worst stuff. It's the stuff that's killing everybody. And it did lots of things, but it's sort of headline measures where this smoke-free generation, denicotinizing cigarettes and reducing where it can be sold. And so, it feels very disappointing that on the first day of the coalition being announced that particular bill's become a casualty, because even during the debate period, the National Party and Shane Uretti, the now health minister, supported a lot of those measures in that bill. They weren't necessarily happy about how they were to be done, and I just think it's very short-sighted to just sort of chuck it into the policy bonfire rather than perhaps look at how they could adjust it to achieve some of the same aims, but in a way that they felt more comfortable with or mitigated some of their concerns.
Yeah, I'm just looking at my phone. I'm not being rude because I wanted to bring up something that Shane Uretti actually said. I included this in a tweet over the weekend in July of 2022. The now Minister for Health and a GP from Northland, a rate of where smoking is really high, especially against the Māori population, said this of the new smoke-free policy. There is advantages, this is a quote, that there are moderate benefits for Māori, particularly younger Māori, around 20 to 30-year-olds, and significant benefits for youth. So that was Dr. Uretti's position 15, 16 months ago. And now, as the Minister of Health, he's going to have to come out and explain why cancelling it all is such a good thing. Seems a bit weird.
Yeah, it does. And I think, the concern I have is that a decision on a major piece of health legislation, I'm not aware that anybody who works in public health or experts, and New Zealand's got some of the best experts in smoke-free research in the world, has had any say in this or had any sort of chance to be consulted on this at all. So, it's a real worry that I feel it's something that's come from some of the coalition partners as part of their deal break to get into power. And it seems that, it's a huge cost to get into power to have to give that up for parties which may have, 5 or 8% of the vote to overturn something which, building up to this legislation, 70–80% of the population support.
Now, I actually was having a conversation with you guys at ASH, but also with the team at Smokefree New Zealand. And they came back to me today saying that they are, here we go, as Smokefree is a part of Te Whatu Order, it would not be appropriate for us to comment on the incoming government's policy at this time. So what we're even finding is that the group kind of put in place by a government to reach the smoke-free target is now saying, well, we can't criticize the government. I'm really concerned about that as well, because even if we tried to get smoking down and, for a government department to do with the health of New Zealand, not to be able to even, I'm not even saying criticize, but speak out on a new policy of the government, I find that a little bit scary, because surely this conversation we talk about, the incoming government is very keen to talk about, putting the victim at the center of the crime stats. So why aren't we putting health at the center of the smoking stats rather than going, oh, don't want to upset the new boss? It seems a bit strange to me.
Yeah, and I guess I can have some empathy with that position of theirs as well, because I know a lot of those people. They've been colleagues and I've worked with them for years and years and years.
Sure.
And I know a lot of those people have put huge amounts of hard work and passion and care deeply about the work that's been done to get this legislation in place, and done incredible amounts of kind of brokering behind the scenes to get this legislation to happen. And it wouldn't surprise me if, people are feeling very kind of vulnerable and nervous about what they can say about it at the moment, which is it's I can't speak for them, but I could certainly empathize. It's got to be very challenging to be in that space and see so much hard work that you've done being sort of overturned so quickly.
I would think as well that this is probably, I mean, I don't know exactly what they do at Smokefree, but this legislation and getting this target would, I assume, be the kind of biggest part of their job at the moment. So is there a concern in the community, do you think, that actually maybe they're going to be another one of the departments or the co-government organizations that might be for the scrap? Because if you're not doing this, if this is all gone, what are they left to do?
Look, I really hope they're not going to be a casualty of this, and I still, perhaps with some naive optimism, hope there's something that we can salvage when we finally get an opportunity to sit down and have a conversation with Dr. Reti. I mean, we've got some real policy expertise in that team, and people who spend a long time trying to understand what the impact of things like removing nicotine from cigarettes are, looking at what mechanisms are to change where cigarettes can be sold, and even interesting what is it, for the first time ever, essentially going to be a licensing scheme for selling cigarettes. And the risk is that if we're going to get rid of that legislation, and Christopher Luxon was talking on breakfast this morning around kind of more education about smoke-free, and we're pivoting back towards it being about education, we're just losing so much kind of quality technical knowledge and expertise that could be applied to getting us to that smoke-free goal, and putting it back into sort of the older style tobacco control work that I think we moved on from a long time ago here in New Zealand.
I'd be interested from you, as someone in the industry, or the stop smoking industry, if that is indeed a thing. We heard from the new finance minister over the weekend. She confirmed, begrudgingly, I guess, that they were going to this is going to help fund tax breaks, keeping this on. But when she was challenged by Jack Tame to answer the question, will more people die from cigarette smoking because of this? This was her response, quote, "I have not seen advice or analysis of that, so I am not prepared to answer that question." Now, I guess I'm a bit of a buffhead from the bottom of the South Island, but I think put more cars on the road, you're going to have more deaths from cars. I don't need a PR department or an analysis to be done on that to see that's the truth. We get the guys from Smokefree. I'm not criticizing them, just saying what it is. Not going to come on to answer questions of the media today. And you've got ministers within. I don't think we've heard from Dr. Reti yet, really. And then you've got the Minister of Finance saying, when she gets asked the question, okay, so if smoking goes on for longer than it was and more people are doing it, will that lead to more deaths? To hide behind this, I haven't seen the analysis of that yet, is cowardly. That's the word I'm using. It's cowardly, in my opinion. At least own it. At least go, yeah, more people are going to die, but other people are going to get tax cuts. But what I'd like to know from you is, from someone in the industry against smoking, will we see more deaths with this legislation gone away because of smoking? And I think Jack Tame cited a number from research, which is 8,000 by the year 2040 addition. It would save lives. But what are we looking at? Will the numbers stay where they are? Will we have the same kind of deaths? Have you got any analysis or advice around what this will do to the health of New Zealanders now that it's gone away?
Yeah, so we're probably still facing, I mean, even if everybody in the country stopped smoking tomorrow, we'd still be seeing lung cancer and heart disease deaths for another 20, 30 years. Excuse me, because it would be the knock-on effect, sure, really, of how smoking works. But that's going to last even longer now, because we're removing policies which would have ended smoke tobacco much sooner. You have to excuse me, I've been talking about this all day and my voice is starting to fade.
Sure.
And so the other thing that she said that was very concerning was to suggest that removing this meant that they would protect tobacco tax revenue for slightly longer. They'll be able to afford other tax cuts. So essentially, 50% of the tobacco tax in New Zealand is paid by the poorest 20% of the population. And that's also the part of the population which has the majority, I mean, almost 3 or 4 times the number of lung cancer deaths than the richest, which is all smoking. And so it's essentially, it really, really concerns me that it's not even a sin tax, kind of taxing people who are addicted in the lowest income New Zealand's and are facing deaths from tobacco is being seen as a legitimate and potentially expendable source of revenue. And I think that is probably what the most worrying thing I heard from her comments was.
Yeah, so they're giving tax based on people addicted to cigarettes and the poor. So which, and primarily that also impacts disproportionately the Māori population, and so they're going to keep impacting them by allowing this to still go on, and that's what's giving out tax cuts. So the people are dying literally to allow National to pay for their tax cuts,
and essentially the cost of those people getting sick as a result of smoking will far outweigh any benefit as well, because that's a massive cost to the health system for another 20-30 years, much of which could be avoided.
If people want to find out more about ASH, ash.org.nz, I was thinking you've got a countdown to the 2025 goal. Is someone going to be updating the website and kind of deleting that today? Because obviously National has scrapped this official target. What's the story with that?
Well, look, I mean, I hope we can still achieve it. We have seen record declines in smoking in the last 2 or 3 years, much of which is people switching towards vaping and less harmful alternatives to cigarettes.
Yeah.
I still, again, as I say, perhaps naively, have some optimism we can salvage something from this. And, I urge, and we're requesting and asking for Dr. Reti to meet with us as soon as possible, so we can try and, navigate our way of not throwing absolutely everything out, but trying to salvage some good things and keep up as much momentum as we can.
The director of ASH, that is Ben Youdan. Ben, thanks so much for joining us today. Appreciate your effort, your works, and your time with us. And yeah, good luck.
Hi, you're welcome. I enjoyed talking.